at the stroke syndromes along with the visual symptoms. So to begin with some questions, the first question is, in terms of the Balint syndrome, what is the site of lesion? The second question we want to ask is, in terms of the Perinaud syndrome, name the clinical features. So in this video, we'll find the answers to these questions and learn in detail about them. So first, we look at the Anton syndrome. So what is this Anton syndrome? So Anton syndrome, the site of lesion is nothing but it is bilateral. It is bilateral infarction. There is bilateral infarction. And where does it present? It is present in the distal. It is present in the distal PCS. Next, what is the clinical features of this Anton syndrome? The Anton syndrome, it presents with, there is a cortical blindness. So there is cortical blindness and with a denial or unawareness of blindness. So there is denial. So there is denial or the unawareness of blindness. So Anton syndrome is a bilateral infarction in the distal PCA. There is a cortical blindness, denial and unawareness of the blindness. Next we look at the Balint syndrome. So Balint syndrome, it is a site of lesion. There is low flow in the watershed region. There's low flow in the watershed region. And this occurs between the distal PCA and the MCA territories. So distal PCA and the MCA territories. So what are the clinical features? The clinical features here, it includes the palinopsia, then the simultaneagnosia, then there is also the optic ataxia, and the ocular, there is ocular apraxia. Just to recap, we saw the Balint syndrome. There is low flow in the watershed region, and this is between the distal PCA and the MCA territories. The clinical features, it is the palinopsia, it is the simultaneagnosia, there is also the optic ataxia and the ocular ataxia. Next, we'll move on to the Weber syndrome. So what is this Weber syndrome? So the Weber syndrome, this lesion lies in the midbrain. So it lies in the midbrain, and next question will be, what are the features? The features is that there is a ipsilateral CN3 palsy and there is also a contralateral hemiplegia. There is a contralateral hemiplegia. Then we move on to the Perinaud syndrome. So Perinaud syndrome, it is the lesion in the dorsal. So there is a lesion in the dorsal midbrain. And what are the clinical features? The clinical features, it includes a tetrad of symptoms. So there is a famous tetrad. So we will look at the tetrad. So before that, we'll just summarize what we did. We discussed the Weber syndrome. The lesion lies in the midbrain, and the clinical features is that there is a ipsilateral CN3 cranial nerve 3 palsy. It has a contralateral hemiplegia. Then we discussed about the Perinaud syndrome. Here there is a lesion in the dorsal midbrain, and we are looking at the tetrad of features. Now let's see what this tetrad includes. So now we are going to look at this tetrad. So the tetrad, it includes, there is a loss of the abgaze. There's loss of upgaze. This is the first one. And then we also have, there is a light. There is light near. There's light near dislocation. There is light near dislocation. Next comes, there is convergence. There is convergence. There is convergence. And this is nothing but a retraction nystagmus. There is retraction. There is retraction nystagmus. And later there is also the lid retraction. So let's quickly recap. So we dealt with the Parinaud syndrome, which had a defect in the dorsal midbrain. So the defect was in the dorsal midbrain. And post that, we are now looking at the features that includes the tetrad. So there's loss in the upgaze and there is a light near dislocation. Next, there is also the convergence. Convergence, that is a retraction nystagmus. Then there is also the lid retraction. So then we move ahead. We look at the next one, that is the Benedict syndrome. So what is this Benedict syndrome? The Benedict syndrome, it involves lesions in the midbrain. So it involves the midbrain. And what are the clinical features? Clinical features, it includes the ipsilateral. There is a ipsilateral oculomotor. This ipsilateral oculomotor nerve. This ipsilateral oculomotor nerve palsy. So this is one. Then there is also the contra. There is contralateral. There is contralateral hemiparesis. This contralateral hemiparesis. Then there is also the contralateral cerebellar. There is cerebellar ataxia. Contralateral cerebellar ataxia. Next, there is also the Holmes syndrome, Holmes tremor, and the chorioathetosis. There is chorioathetosis. So just to recap, we saw the Benedict syndrome. It involves the lesion in the midbrain. There is an ipsilateral oculomotor nerve palsy. Then there is a contralateral hemiparesis. There is again a contralateral cerebellar ataxia. Then there is the Holmes tremor and the chorioathetosis. Now we will be moving to answer our questions. So the first question we asked was, in case of the balance syndrome, in terms of the balance syndrome, what is the site of lesion? So here, the site of lesion. So the site of lesion is nothing but the low flow. There is a low flow. The low flow in the watershed region. A low flow in the watershed region. And this lies between. So where is it present? It lies between the distal PCA and the MCA territories. Just to recap, we saw the Bellin syndrome. The site of lesion is a low flow in the watershed region between the distal PCA and the MCA territories. So then we move on to our second question. The second question we asked was, in case of the Parinaud syndrome. In case of the Parinaud syndrome. Here, what are the features? Clinical features. So first thing we need to know that there is an important tetrad. There is a tetrad of symptoms. So there is 4 points which we need to know. First is there is a loss. There is a loss of the upgaze. So the patient isn't able to upgaze. Then there is also light. There is a light near. There is a light near dislocation. There is a light near dislocation. Then there is also a convergence. There is convergence. There is a convergence, retraction. There's conversion as well as the retraction or nystagmus. Then there is also the lid retraction. So just to recap, we saw the Perinaut syndrome, the clinical features. It includes a tetrad. So it includes the loss of upgaze, the light near the dislocation, and there is convergence, that is the retraction, nystagmus, and also the lid retraction. So this was about the stroke syndromes and the visual symptoms. So to learn and grow daily, please do subscribe.